Hello and welcome to Ask Dr. Gupta. There have been some disputes between insurance companies and the hospitals in recent past about cashless treatments. And these disputes have kick-started discussion on the utility of cashless policies. We shall try to discuss this aspect in detail today. Our discussion of today might also help us in understanding that why there are big hospital chains that also have insurance companies. This is Twitter post from a well-known journalist. He had a policy for his family of hefty amount and a claim of 10,000 rupees was rejected. If he is that frustrated, then the condition of a common person can be anybody's guess. This matter was resolved by the insurance company and the payment was made later when the matter was raised on social media. But not everybody is that lucky all the time. Will you believe me if I tell you that the average amount paid by the insurance companies to patients, cashless or reimbursement, in the financial year 24-25 was 81,000 rupees. The year prior to that, it was 71,000 rupees average amount. And 2 years back, it was only 31,000 rupees, the average amount paid to the insured from the insurance companies. And people buy insurance policies with 15 to 20 lakh rupees as the sum assured. Many people I know who are paying 2 to 3 lakh rupees per year as insurance premium. And will you believe if I tell that it is possible that the insurance company might refuse to pay the amount it approves to you, it promises you at the time of your admission to the hospital for treatment? Insurance companies play smart in other ways also. Many treatments are not paid for because they dig out old history of tobacco or alcohol usage. Families buy big insurance policies with the hope of getting relief from big hospital and medicine bills, but this may not always be true. I am a cancer specialist, so I can tell you about cancer treatment. Many, if not most of the policies refuse to pay or reimburse the costliest medicines because the fine print in the policy agreement says that the treatment by immunotherapy is excluded and immunotherapy is the costliest part of treatment. So please check your own policy bond for this. The Association of Healthcare Providers of India, AHPI, that represents the hospitals had threatened to suspend cashless treatments for patients who are having policies with Bajaj Allianz Insurance Company starting 1st of September. The reason was outdated reimbursement rates and delayed payouts even of those outdated rates. After meeting between AHPI and Bajaj Allianz, the insurers agreed to renegotiate the rates and protocols with the AHPI, and the cashless services have been restored. The company is expected to submit a formal action plan regarding the discussed issues by 29th of September 2025. This has happened now, but even before this, many hospitals had surrendered empanelment for cashless treatment with two big insurance companies simply because of the unviable treatment packages. On the other hand, Niva Bupa suspended cashless treatment at all Max hospitals in the country after their agreement expired in May 25 and the ongoing discussions about revision of packages remain unresolved. This suspension was effective from September 1st, 2025. Patients could still claim the amount as reimbursement. The issue has probably been resolved now, but there was panic in media circles at least. And there was a question that why there is this hostile attitude from both the sides. Is cashless treatment actually that good that it should be a topic of hot media discussion? Is it actually cashless? Or should we still be saving money for treatment for family members even after buying an insurance policy? Are the expectations of public from insurance companies actually unrealistic? And at the end of the day, do we actually save money by buying health insurance policies? Or we give away more money than we actually get? Do insurance companies actually pay the full amount that you have paid the premium for? Why many doctors, especially senior doctors, refuse to treat under cashless programs? Let us discuss all these issues one by one. Western standards measure the health security of any community of any country by the percentage of population having health insurance. By these criteria, health of any person who is not insured is at risk. However, Western criteria also measure the nutritional status of a community by per capita meat consumption. Meat consumption low means malnutrition. If we follow these criteria, then vegetarians like me will be universally malnourished. So these criteria might not be sacrosanct. Most of my patients are uninsured and still they complete their full treatment. So uninsured means dying of disease does not hold true, at least in our country. Universal treatment by insurance companies in self-proclaimed developed countries means that any treatment can be taken only if that particular treatment is approved in that illness by the insurance companies. Otherwise, they will not reimburse the cost. It means the treatment will have to be held back even if the doctor feels that this is going to help the patient. simply because the patient is not paying and some third party is taking final decision. So fat insurance policy might not always ensure the best treatment. The Western societies actually have traditionally been consumption based societies. It is the Western culture that brought the concept of credit card to our country, spending tomorrow's income today. So they find it almost impossible to fund treatments from their pockets because everything else has already been spent. For them, no insurance might mean no treatment. On the other hand, so-called poor countries like ours have always been focused on savings. We have been able to withstand crises like the recent Wuhan coronavirus pandemic because of the saving habit of the population. The habit of saving has also been able to steer our country through various wars and through various periods of sanctions. In addition, the concept of family that fortunately is surviving in our country till now has any member in problem supported by entire family and sometimes even by the entire extended family. Does having an insurance policy actually helps in saving money? Do insurance companies insure people out of charity to help the communities? Or is it just manipulation of human psychology to earn profit? Let us analyze. First, we need to understand that cashless treatments are actually seldom cashless. The insurance companies or their third-party administrators, TPAs, they exclude some disposables that are to be paid for. Plus, some policies have co-payment costs. Co-payment means we have to pay a fixed percentage of the bill even if we are availing cashless treatment. People generally fall into the trap of co-payment because the premium for these policies are relatively less, they are cheap. Most of the insurance policies have capping on room rents and on doctor's charges based on the city. It is a tier 1 city or tier 2 city, the room rents and the doctor's charges are capped. These things put together can sometimes force one to bear some part of the bill even when the insurance company is paying. One more problem: when hospitals get empaneled for cashless treatment with any insurance company, they sometimes commit discounts to the insurers. Some, if not many of the hospitals, they ask this discount to be paid by the insured, by the patient. All this means that one needs to save money for illness even if the person is having a health insurance policy. One situation that might make one feel cheated is not known to most of the people buying insurance policies. The insurance companies now have fixed all-inclusive packages for individual procedures. This has become endemic after introduction of Ayushman Bharat. This can be understood by my own example. I had an insurance policy of 5 lakh rupees. Add to it the no claim bonus of 1.5 lakh rupees. That means the total amount insured was 6.5 lakh rupees. However, when I got operated for my own kidney stone, the package for the procedure in single occupancy private room was 28,000 rupees. And this 28,000 rupees was including of doctor's fee, of anesthesia charges, of OT charges, of room rent and also the medicines. The sum insured is 6.5 lakh, but the hospital for this operation got only 28,000 rupees. This 6.5 lakh rupees is the total amount that me or my family can claim in one entire year. So a policy of 10 lakh rupees might not mean you can get a all paid treatment at a luxurious center. These situations where the insurance company might have to pay the entire 6.5 lakh or 10 lakh rupees will be emergencies, medical emergencies as well as surgical emergencies. Elective procedures mostly have fixed packages and these packages are all inclusive. While these packages might be fair in Ayushman Bharat and other government schemes, they, to me at least, are clearly unfair in insurance policies. The government does not charge 5,000 rupees per lakh premium from Ayushman Bharat beneficiaries. On the other hand, the dream of 10 lakh rupees per year cashless treatment is sold at hefty premium to the unsuspecting people. The problems do not end here. One dangerous trend has started among insurers in last 2 to 3 years. This is declining the payment that they commit at the time of admission, the initial group amount. Let us try to understand this. When someone gets admitted to a hospital for a procedure, a provisional estimate is submitted to the insurance company with tentative plan of treatment and tentative expenditure. The insurance company then approves an amount provisionally, which is called initial approval. When the treatment has been completed, then final bills are submitted and the amount that is submitted at that time is called the final approval. It is the amount that is actually paid by the insurance company later on. Earlier, the final amount of approval was more than the initial approval because the initial approval was provisional, while the final demand was supported with bills. In last 2-3 years, the final approval is many a times less than the initial approval. Citing one or another excuse, this can be understood by an example. Imagine if the main earning member of the family is admitted to the hospital. He gets admitted and is told that the insurance company will be paying 1 lakh rupees for this procedure. The person gets treated. At the time of discharge, the person is told that the amount approved to be paid is only 80,000 rupees. You have to arrange it 20,000. And the main earning member himself is admitted. Imagine how big a problem this will be. And the hospitals generally do not let the patients go home before final approval comes, even hours after the completion of all discharge formalities. The patients have to wait for hours because whatever amount is approved finally also sometimes takes time. So if the final bill is submitted at 12 afternoon, it is quite possible that the final approval might come at 8 in the night. So it is quite possible that patient might be late to go back home. Many doctors, especially senior doctors, they simply refuse to treat the patient under cashless schemes. Why? The reasons are many. First is that the medical stores generally insist on giving generic medicines to insured patients because of heavy profit margins. All medicines are billed to the insurance companies at MRP. This helps the hospitals retain the maximum share of the fixed packages. I have seen pharmacy flatly refusing to give original research molecule, original research brand to an insured patient under cashless scheme because the profit margin is only 5 to 10%. When a patient is getting treated under cashless treatment, the families most of the time are not particular about the brand of medicine that is being used for them. The patients sometimes, not many times, but sometimes they get medicines of doubtful quality, and the consequences, the complications will have to be handled and will have to be explained by the treating doctor. Add to it the minuscule compensation left over after the deduction of hospital charges at full, and the reluctance of the senior doctors becomes understandable. The Ayushman Bharat beneficiaries are poor, and serving them has a satisfaction at least of serving the poor. The ECHS patients are served mostly at unviable packages out of the respect for the armed forces, but no such motivation exists when one is treating a patient who is having an insurance policy. Billing at MRP means insurance limit will get exhausted very fast, and family might end up paying even after insurance. So the pharmacy of the hospital is the happiest with cashless treatments. They get 3 to 4 times the cost price of the medicines. And they also take hefty sum from the unsuspecting insured people in the name of disallowed consumables. And hospitals many a times, they engage younger doctors for treatment of cashless insured patients because the senior, more experienced doctors charge more and these younger doctors charge less. One more thing to be understood is that the emergency, when we know that the insurance company might end up paying the full insured amount, are very costly. The expenditure of treatment in any ICU of a good corporate hospital is around 1 to 1.5 lakh rupees per day. In such a situation, most of the insurance amount will get exhausted in less than a week, and family will end up paying from their own pocket. Anybody is more likely to need money from insurance company when the age increases. This is because of age-related illnesses and also because of dwindling income with the passage of time. The insurance companies try their best to exclude this population from the insurance policies. The young, who are unlikely to need any payment from the insurance company except accidents, are actively engaged, are encouraged to buy insurance policies at lower premiums. But as the age increases, the premiums increase and sometimes reach prohibitive levels. My own father was having an insurance policy for 30 years and he was asked at the age of 70 years to pay 27,500 rupees annual premium for an insured amount of only 1 lakh rupees. His fault was that his age had become 70 and he had claimed for cataract treatment in the past insured year. And even the money paid for that cataract treatment was slightly more than half of what the actual amount was paid. Insurance companies also exclude frequently needed items like specs because they know that any good quality spec will cost 8 to 10,000 rupees, and this is one thing that will have to be changed every 6 months. So all this should make one understand that insurance is for the unforeseen, for the emergencies, not for routine events of life. The expectations from insurance companies should be realistic. The question after this discussion will be whether to buy an insurance policy or not, plus how to outsmart the insurance companies. I can suggest a few things based on my experience in dealing with different insurers in my patients. First is that almost nobody recovers the premium that has been paid in his life to the insurance company. Therefore, do take a health insurance policy of decent amount, but do not pay annual premium in lakhs. Insurance should be only to cover emergencies. And do not think that just buying a health insurance policy means you have outsourced the health of your family. No. Please keep decent amount of money immediately accessible for illnesses. You will need this in spite of buying an insurance policy. Second important point is that do not conceal any illness or any tobacco or alcohol habit at the time of buying a policy. This one mistake can make all your paid premiums go waste. In any case, the pre-existing illness and the substance abuse will be picked up by the insurance company and the claim will be declined. So why waste money on buying a policy which is not going to give you a return later on? Third suggestion will be to avoid cashless treatments if and when it is possible. Please make payments, take all the discounts, ensure best treatment, and then submit the bills to the insurance company. Every reasonably good hospital will generate your bills even without asking. If they don't generate, then you can ask for it. It is your right to ask for a bill of any expenditure that you have made. This is the best way to ensure best quality treatment, best quality drugs, and also to avoid inflated bills. The bills that are made at 4 to 5 times of the cost price. This will be avoided if you are making payment from your pocket and then reimbursing it. The limit thus saved might be useful later on in a rainy day. Fourth point is that the corporate insurance policies are generally better than individual policies. The drama of declaring every second illness as pre-existing does not apply to corporate policies. The reimbursement amounts are generous and less hassles are created as compared to individuals. The reason is that the insurers dread losing the entire corporate house if they create problem in any single insurance claim settlement. To sum up, do save money for illnesses even after buying an insurance policy for your family's health. And do not expect cashless treatment to be practically free treatment. It will be better if you choose your doctor by yourself, the hospital by yourself before getting admitted, except in emergency situations. And try to avoid cashless treatments whenever your pocket permits. With all this, I wish you all a very happy and healthy life. Thank you. Namaskar.